So the reason I made this because the implant sides are all sticking out facially. So we change it, the hybrid bar, because people do not want to see the hole here, hole there, hole there, hole there. So normally you can do with a screw-retained denture, acrylic, and then we make the hole, and then doctor can patching it. It's really good? Well, not really, because not perfectly matching with the teeth, which is I fabricate. So I'm losing my detail, which is frustrating. Right, the screw-retained, the problem is the same thing. Zirconia is more problem. I cannot make two piece because the tooth is sticking out, and then we change it. But this case, I want to change everything, which is not good situation. So we change everything with the locator, okay? And then top of that. And also, doctor can take it out, put it back, take it out, put it back. That's the best benefit. If you have implant angle, not 1, 2, 3, 4, 5, I recommend screw-retained. I recommend Locator zirconia, which is removable zirconia. I made all monolithically. That's the point. It's been a while regarding the zirconia cases, which one is better. Probably I made 2 years ago regarding the screw-retained acrylic and screw-retained zirconia. But today is 2020, October 26. Now I come up with a different strategy for another solution, which is the zirconia locator. Do you know what is zirconia locator meaning? Removable. Okay. What is the difference the locator zirconia compared to screw-retained zirconia? Okay. Number one, screw-retained zirconia, patient have to put together, which is doctor. I'm not a dentist, I'm a lab technician. I do have a beautiful, my place, which is I spend money. So dentist can put in the patient's mouth, then screw down. Okay. Number one problem is sometimes they have a cleansability. Okay. So they cannot clean except they have a little floss they can clean, or otherwise they have to go to dentist every 6 months or every year. So they have to take it out, top down, and then clean completely, and they go back to home. If they don't clean it, depends on the implant size. They will going to set the plaque, and the smell is not that great. So why do I make the zirconia locator? Well, couple of reasons. Number one, if they have so many implants or there's a big, they want to take it out every day. So then I recommend it, which is the removable. So technically, patient has the hybrid bar, and on top of this we have to put it into locators, which is from the Zest company, and then top of that we fabricate it with the zirconia like this. Put it in the housing and then cement it, which is my video can show you a little briefly how we cement it. cementation too. And then they put together, and then they click. Is here? It's a click. Okay, so they can go to anywhere. But every day, you can take it out. Okay? Only thing you have to careful about before you go to shower, you have to watch out this. Alright, just be careful. This is the zirconia, which is heavy, just like normal as the other one, but be careful about this. This is a fragile too. So compared to this, the 6 months they wear it and then go to dentist office and take it out clean. And this one, locators, they can do everyday clean. And then which one is better? Well, it depends on the case patient too. If patient has a really good gum design or dentist placed implant really nice, you don't need it. You don't need very good hygiene underneath and not much foot trap, so you can go to the dentist if you want to. But if someone place implant, some reason, bone loss and many other among the issue, they place implants, then we can go to locator. So they can take it out the mouth every day, and then they can clean whatever they cleaned underneath. Okay. So we fabricate today, which is Dr. Seth Sapiro in Florida. So this is upper. So I'm going to show you a little bit more detail regarding the design about the cases, processing. So processing is here. Doctor took the impression first time. So we fabricated bike lock and wax trying for them. We don't need the verification jig. If fit is really good, sometimes they need a verification jig for hybrid bar, that's fine. So we fabricated. And the other one I would like to mention it regarding the milling strategy. You can see it in my video too. If we have the angle is different, which means that whenever they place implant, the most of the time the angulation is different. So if I have an angulation different, we can change it with bolt attachment type from Create, and then we can change it. We can manually commit it, wax and metal casting, and then we finish it. That's another option for the when we have the all different angulation. Alright, Locator zirconia, just mill from jeweler, milling machine, just drop right in. Awesome. Alright, so I like the detail of the contour, thickness. Alright, great job, the jeweler. Brian, thank you. So it is, we just grind a little bit, but it's perfect. Now Locator zirconia. Okay, so removable zirconia at the top. Ready to. This is really fit good. Awesome. Okay, so like I said, this is the beautiful bleaching teeth color, and they made a 6 locators is maxillary. Here's a behind the story. They milled the grade A, just like that, which is jeweler, just they milled for me. But they milled again with the pink, which is we utilized it more layering technique, just thin as possible, because this is the thickness. We make a little bit, make the thinner, because it has the undercut in between the tooth. So we're trying to see the path of insertion, the underneath. So anyway, we finish is upper, just like that. Okay. Right, so now whenever I push it, which is cement, and then this, cool, that's the sound. That never move it usually, right? Okay, that's good. The lower side, same thing. Lower, we finish it with the highest aesthetic, kind of a bleaching, but we made a good vitality underneath hybrid bar. So remember, I talked to the hybrid bar underneath. This is, we don't need the hybrid bar, and this is the, we put the different custom bottom on top of that. So first, okay, first doctor took the impression, and then we fabricated the wax try-in, the bite block, everything, verification jig for this. But this is upper, so we make the custom abutment, the locator here. So we don't need a hybrid bar, so we don't need a verification jig because we're not going to use it. But this one, we made a verification jig lower. Okay, now we're going to polish a little bit. And this lower, look at this. Here, can you hear it? 1, 2, 3. It's like that. Okay, so it's very tight. See? So now it's all top and bottom. We finished the top of the line cases. It's like that. Unbelievable aesthetics. We're not compromise it. Right. This is kind of a jewelry set like this. This is eccentric. All in one occlusion, all monolithic. All right, that's good. So we give them 2 as a final stand 2. Anyway, thanks for watching my video. This is today's, I'm glad I explained to you guys about the different zirconia option, which is removable full-mouth implant zirconia case. Right, this conclusion is depends on the case, like I said. I mean, the people said there's only all the time the zirconia mount. It's not that way. If I have the case, if they have a cases, there's a lot of dentists did not know much about the option. Okay, so whenever you pay, which is, I'm talking about patient pay to the dentist, and then we have to see all different options. So dentists have to look at the other laboratory. I know the other day some doctors call me, hey, look, I will send you a lot of implant case for you, because if you can give me the good deal. I gave him the good deal, but I don't need all your work. I told them, you know what? One by one, I'm okay. I said, you know, I'm not pleasing whenever they say I can give you 100 implant. First, I cannot fabricate it. I'm trying to take care of the cases. I'm those kind of guy, okay? So when you have a case, sometimes doctor said and patient said, look, his price is a little bit higher than whatever they use. But of course, this is custom made, right? I mean, my price is not ridiculous high. I would say probably 20-30% higher than normal lab, commercial lab. That's about it. 30% probably. Now, this is the important case. You want to cheap about this? You cannot get a best product. You want to get the good product, then you can talk to not only me. There's a lot of good technicians out there. Okay, talk to them, discuss with them. What is the final prosthetic will be? I hope this video will helping you guys can judge for your final product. Like I read a lot of comment, they said, look, I paid this much money, I paid this much money. It's not right, it's not fair. But you better watch out when you get the final product. And then you can see my final work, just like the jewelry, just like artist skill, right? It's bleaching, but beautiful aesthetic this. Thanks for tuning in my social media, Facebook, Instagram, LinkedIn. Appreciate it. See you next time.